Good afternoon.
Good afternoon.
And to folks at home, we just wanted to remind people that I'm reading questions that reporters from all over southern New England are submitting here on a monitor in real time. So we wanted to begin with this question today. What is being done by the state to help homeless advocates who are trying to reduce the density in the congregate shelters, especially Harrington Hall, Crossroads Women's Shelter, Emmanuel House, and the Rescue Mission?
Yeah. So my administration is working very closely with all of those advocates. In addition, we are in the process of procuring or leasing several hotels where we will be able to quarantine folks who are homeless so they can be there safely. But I would like to give Brett Smiley, my Director of Administration, a minute because we have a lot going on in that area.
Thank you, Governor. As the Governor and Dr. Alexander Scott have talked about a few times, this virus seems to be impacting those most vulnerable especially hard. That's no more true than anything with the Rhode Islanders experiencing homelessness. And so we have had a team in place for some time, and as the Governor referenced, we do now have, in fact, emergency shelter situations available for those experiencing homelessness who need to be quarantined or isolated. Those structures are in place. The next step is for us to work on de-densifying the congregate settings, and we're working closely with advocates and are making progress along those lines. And finally, as we all do our best to meet the needs, this is a good time to thank and remind Rhode Islanders that the joint effort between the Rhode Island Foundation and the United Way to marshal both philanthropic and corporate support to bolster the social safety net is really helping fill those gaps. And so we want to thank the Rhode Island Foundation and the United Way, but also ask all Rhode Islanders, corporate charities, and other philanthropists who might be able to chip in. Government is doing its best to meet these needs, and we will continue to make progress with the homeless advocates, but there's a role for private sector social service agencies to play as well, and so we appreciate any additional contributions and support that you can give them at this critical time.
A state-by-state study by the University of Washington shows Rhode Island will see a peak in hospitalizations on April 19th and as many as 259 deaths by August. And the question is, does Rhode Island's modeling reflect the same trends?
So we are very familiar with that model. In fact, we are in touch with the University of Washington. Our model looks a little different. Our model would suggest that the peak is further out, but also higher. Having said that, we're still working the model. None of these models are precise enough. At this point, we still have limited numbers, 8 deaths, 59 people in the hospital. We're reaching out to Brown University, Johns Hopkins, our own top-notch epidemiologists at the Department of Health. So I would say that model is directionally correct insofar as those numbers are probably in the ballpark, but we're still refining our model to reflect the actual experience that we have here. And we're probably at least a few days or a week away. Again, we just need more data to populate our model. I will say this, the entire model depends on the level of effectiveness of our mitigation. So if you get under the covers of the model, like any model, it's all dependent on assumptions. The biggest assumption is the rate of compliance with social distancing. So if we are very good at our social distancing, if people are staying at home, washing their hands, limiting your contact to 5 people, the model will look very different. Slower peak, lower peak, fewer hospitalizations. If we keep pushing the limits, then it's going to be worse and higher and sooner.
Governor, the mayors of Pawtucket and Central Fall want Memorial Hospital to reopen to help with the crisis. How realistic is this, even if CARE New England agrees?
Those mayors know, as we're in touch with the mayors every single day, and they are free to make those comments on these phone calls. Public statements like that on the basis of limited information aren't very helpful right now. The Army Corps of Engineers has been on the ground working around the clock for over a week with General Callahan and his troops. That is in the mix. Memorial Hospital would be incredibly expensive to reopen. Are we looking at it? Yes. Are we looking at another 15 to 20 alternatives? Yes. So as these mayors know from our daily calls, we are looking at that. We're looking at the convention center. We're looking at everything. You can assume every hotel, abandoned building, former hospital, convention center, large hall, formerly occupied business building. We have engineers, architects, and the Army Corps all over it trying to make a statewide plan to meet the needs of COVID.
Next question asks, with the General Assembly unable to meet, decisions are being made by the senior leadership from the Democratic majority. Would you be willing to bring the senior leadership from the Republican minority into the process to ensure fair representation?
Yeah. So, as the governor, I have never, nor will I begin now, to tell the legislature how to do their business. I don't know of any decisions that are being made by legislative leaders. As I said yesterday, they've been very supportive. The Speaker and Senate President have both assured me that they're there to support me and our team in this effort. There's no need at this moment for any legislation. When the time comes, and I don't know when that will be, then I'll call the legislature back into session and we'll figure out what to do. In the meantime, I'm asking all legislators to do what you're doing. Stay home, stay in touch with your constituents, and do your very best to get the word out to your constituents and also to get the word back to us. You know, I need to know what your constituents are thinking, needing, worrying about so that we can together respond. I, of course, am happy to take any phone call anytime from any legislator and would welcome any of them to call if there's anything we can do collaboratively or to be helpful.
Governor, we've been hearing from a lot of people who have joint custody of their children. What's your advice to people who have co-parents that live either in Rhode Island or out of state?
Thank you for that. So this is a important decision to make. Our key with addressing the spread of this virus is to limit the number of interactions that are occurring with different people. As I spoke of earlier, we know that the virus can land on surfaces in the public that have frequent touching of members of the public. Because of that, whenever possible, it is most helpful to stay at home. If there are creative ways that co-parenting can occur with video, teleconferencing, calling more frequently by phone, that allows you to be able to stay at home and stay safe while still doing the co-parenting that's needed, it's something that we strongly recommend.
Next question is about groceries. We're hearing and seeing reports of food shortages in the grocery stores. What can you report about the supply of staples entering Rhode Island this week?
Yeah, so we've been in touch very regularly with the grocers, both the local grocery stores, locally run and operated, as well as the national chains. They continue to report that they are receiving supplies. Obviously, this is an extraordinary time, so you're not going to be able to get everything you want, precisely what you want, when you want it. But still, there's no need for hoarding. There is need for some patience. But from everything that I know, and we're tracking it, food supplies are coming, interstate commerce is happening, the trucks are coming, shelves will be refilled. Be a little bit patient, but don't worry. Don't worry. The food and supplies are coming.
Are you aware of any plans that the U.S. Department of State is organizing flights from the Dominican Republic to bring U.S. citizens back home to Rhode Island? Where can they get more information about this?
I am not aware of that, so I'll have to, I see that it's Tony from Podair, and we'll get back to you.
Next question, we're hearing about guidance models. Oh, excuse me. The mayors of Pawtucket and Central Falls, we've already had this question as well. What can you tell us about the hospitalized patients, their ages, the number intubated, and do they have pre-existing conditions?
So for the hospitalized patients, we said that we have 59 of them. We do have about 14 who are in ICUs, and 9 of them are intubated. The ages range I think it's an important message to be able to let people know that this virus is impacting people across the spectrum. We know for sure that the numbers are more concerning in terms of the outcomes in our older population, but those with underlying illness can range from 30s and up. And then there are occasional times when we are seeing younger, healthy folks also get admitted to the hospital. So the more everyone can abide by the community mitigation rules we are saying, it is true when we say it's not only for your benefit and for your loved ones, but it is also for all Rhode Islanders. You can start to look around in neighboring states where there are more cases that are occurring and more hospitalized cases. It is impacting folks across the age, and the unfortunate deaths are occurring at varying ages. So we need particularly our young adults to understand how serious this is. Thank you.
You may want to stay for this next question. Massachusetts is seeing a dramatic increase in deaths and quarantines in several nursing homes. Knowing that the coronavirus does not know state lines, please provide detailed information for what the status and protocols are at Rhode Island nursing homes, particularly the Veterans Home and Oak Hill Nursing Center.
This is critical because this is where our most vulnerable community is. We have been having conversations with folks nationally, in Washington, in DC, and others, to make sure we learn and cull all the information we can to help protect our nursing home community. With all of that being done, there can still be challenges, as we're seeing across the country. We currently have in Rhode Island 3 nursing homes where deaths have unfortunately occurred. 2 were at Golden Crest, and 1 was at Oak Hill. The 4th fatality was not a nursing home resident. We are also seeing nursing homes where there are groups of cases that are occurring. That is both at Golden Crest Nursing Center and Oak Hill Health and Rehabilitation. At another facility, we've seen 1 isolated case. We will only be reporting names of nursing homes if we are seeing groups of cases that we are responding to help balance the release of information that's needed and the confidentiality. This is consistent with the policy that we've taken with information about schools, organizations, and other facilities that have groupings of cases occurring. I want to ensure that we are being as aggressive as we can be with handling these nursing home cases. I want to also credit our nursing home community. They have been active, they have been engaged, they have been dialoguing with us on a regular basis and looking to see all the things that are needed to help protect their community, including their residents and their staff. And as I shared earlier, with the step that we're doing with having nursing students be able to have a temporary certified nursing assistant's license, we will continue to provide updated guidance on the steps that we're taking to make it so that we can maintain the capacity needed in our nursing home settings as well as in our healthcare facility settings. I'll also reiterate the aggressive approach that we are taking with surgical masks. We want, and many have already started doing this, we're just making it clear it's across the board. Every healthcare facility, hospital, and nursing home to have all of their healthcare workers wear a surgical face mask to protect themselves from having symptoms that they are unaware of be transmitted to patients in this vulnerable population. Anyone who has symptoms that they know of should not be reporting to work, period.
Next question is for the governor. Back to kids and school. What is the plan for children in special education classes? Has the 10-day period expired?
We are providing education remotely and virtually to all children, including those with special education needs. And I believe the answer is yes, that the 10-day period has expired. I can check on that and get back to Tara. As I said yesterday, the challenges with certain populations, kids with IEPs, English language learners, kids with special needs, are definitely greater. We are making progress, and it's a top priority of RIDE. Overall, I've been pleased with the efforts, and again, I think a week from now and 2 weeks from now, as we continue to innovate and learn, we're going to get better and better.
Why has Massachusetts seen a much more significant increase in testing compared to Rhode Island?
They haven't actually. They're testing about 3,500 people a day. We're testing about 500 to 600 people a day. So on a per capita basis, it's very similar. And as I said, I hope that by the end of this week, we'll be closer to 1,000. It's a struggle everywhere. It is a struggle everywhere, and we're doing the best we can. As I've said many times, it's just a complicated process. Not only do you need the machines, you need the swabs, you need the testing kits, you need the reagents, and you need all of them in the right quantity at the same time. And to get that, I'm going to fight on our own with everyone else in the world trying to get these same ingredients. So we're roughly in line with where Massachusetts is, and I am hopeful. I began my day with a briefing call on testing. We started just yesterday. Primary care providers can order tests. Tomorrow we'll be up and running with the drive-through testing, so I'm confident that in the next few days we'll be much, much better than we are today.
And for our last question today, just to continue this thought, you said on Monday that more tests will allow you to better plan the state's response. Can you elaborate on that?
Yes, so where we want to drive this, as right now we're in clearly crisis mode, and we've taken a blunt approach, shut down all restaurants, all businesses, et cetera. Where you want to drive that's not sustainable. We have a 10-15% unemployment rate right now. I cannot let that exist for one day more than necessary. So where we need to drive this is an ability to have widely available testing, so that anybody who needs a test could be tested regularly, get their results the very next day, and then if they're positive, they are isolated, and we do quick contact tracing. When we get to that kind of an approach, which is similar to what they have in Singapore and South Korea, then you can get into the business of reopening the economy. But until we have an ability to pinpoint either by the person and then get them into isolation and all the people around them, or by the neighborhood or geography or home, it's just too dangerous. So the goal is really crank up the testing. I'd like to move us to kind of a digital, electronic way of doing symptom tracking and contact tracing. Once that's in place, then we can reopen the economy in a new way with new regulations, confident that we can quickly pinpoint who's sick and get them effectively into isolation.